My name is Stephanie, and I work for Medtronic. And tonight I have the pleasure of hosting a webinar where you're going to hear from Dr. Shabana Shahid, who's a gastroenterologist with Bethany Medical. Dr. Shahid provides experience and compassionate care that you would expect from a top-notch physician. She offers a full range of gastroenterology services and procedures with a special interest in incontinence. Thank you, Dr. Shahid.
Okay. Thank you, everyone, for joining. I'm super excited to be here today.
I'll control the slides, doctor.
Okay, perfect. Thank you.
Yeah.
We can go to the next slide. So I hope the introduction today gives you a little bit of an idea of what we're here to talk about. Who you just heard was a wonderful, sweet patient of mine who saw me about a year ago, and she was having some difficulties with urinary leakage and bowel leakage. And so sometimes people ask me what that means, and that means just sort of leaking a little bit of urine or leaking a lot of urine, or even accidentally passing some stool, not knowing that you've passed any stool. And these are sort of the issues that I help address. So questions that I often hear in the office are, will I ever regain control? Can I go to an outdoor celebration? I'm afraid to leave the home. Like, I'm really worried that something's going to happen if I'm out. Will I ever be able to wear white pants again? You know, summer season's coming. And, you know, how can I possibly go on a date? How can I have someone sleep over at my home? And even in terms of getting a job and having to explain using the bathroom often, or, you know, needing to maybe work more remotely from home. And basically, the bathroom is always on your mind, and it's embarrassing. So many people have this issue, and it's really unfortunate that they don't talk to their primary care doctor about it because they're embarrassed. Even myself as a gastroenterologist, you know, sometimes I have to tease out the symptoms. So today, you know, everything is anonymous, so feel free to ask questions, you know, at the end. And I'm hoping that, you know, what I have to offer will be able to help several of you. So next slide. So bladder and bowel issues aren't inevitable. So, you know, what you may be going through may not necessarily be normal, even though a lot of people say, oh, this is happening because I'm getting older. This is happening because it's, you know, I'm a female. This is happening just because it's my time, but it's not true. These are not things that just happen because of being older, but there are therapies to help you out there. So in terms of looking at urinary issues, if we could go back one slide. Thank you. So in terms of like urinary issues, think to yourself, do these things sound familiar? Are you urinating more than 8 times a day? Are you having that urgency? Oh, I gotta go, I gotta go, I gotta go. If I don't get to the bathroom, I'm gonna have an accident. You're planning your activities around the bathroom. You go to the bathroom before you leave. You get to Target. You're finding out where's the bathroom. You're looking for it. You sort of monitor how much you drink. So, you know, if you're going to go out, you're not drinking anything. If, you know, you have an appointment, you're not taking certain medications until you're done your appointments. And then the obvious thing, if you're using pads to control your leaks. Another thing is, are you getting up multiple times at night to go to the bathroom? Because again, that's not necessarily a normal thing. If you're having some of these issues and your body is telling you that, you know, you have to go do something. So you're not alone. This is an issue that affects millions of people all across the US. We're talking 43 million people can have bladder control issues. That's 1 in 6 adults. So we're talking about, you know, it can be as common as diabetes. About 1 in 12 adults has bowel leakage issues, and that's 21 million. And then there's a strong overlap between the two, where some people have both bladder and bowel issues. So it also affects people of all ages. So it's young people, it's old people, and it's everyone in between. So this is not a disorder for just elderly people. And then it also affects males and females. Most often we see this issue in females, but we do have a high population of males who have this problem as well. So ignoring this issue can really cause sort of a loss of self-confidence. You can, obviously lose sleep over it if you're having symptoms. It can decrease your self-esteem, and it can actually give you a lot of anxiety if there's issues where, you're concerned about going to the bathroom. Next slide. So the good news is there are treatments that can get you back to living a normal life. And this can start with dietary changes, medications, in addition to advanced therapies, which we're going to talk about all of these. So there are several things that can cause bladder and bowel control problems. And sort of the first thing that I like to tackle with my patients are, what are they eating? What are they drinking? What medications or supplements they're taking? What kind of lifestyle have they had in terms of, especially if you're female, like pregnancy? If you're male, have you had sort of prostate issues? So it's sort of looking at the overall health and seeing what is truly causing your problem. So next slide. So how does the bladder work? So basically, your bladder or your kidney starts to make urine. This urine gets collected into the bladder. When your bladder is half full, that's when you get a signal that goes to your brain telling you, okay, it's time to go to the bathroom. And then what happens is your brain sends that signal to the bladder saying, okay, empty. Whenever there's a disconnect between the message going from your bladder to your brain and then your brain to your bladder is where you can develop issues of urinary leakage. So certain treatments are aimed at sort of helping treat the urinary issues with medications, but the advanced therapy I'm going to talk to you about actually goes to trying to treat the brain and the bladder miscommunication. So next slide. So bowel control. So how does that usually work? So, you eat something, your food moves through your stomach, your small bowel, it gets to your colon. And when it gets to your rectum, which is the bottom of the colon sort of stretches out. And that is when a message is sent to your brain saying, okay, I think it's time to go to the bathroom. Then your brain will send a message to the rectum saying, okay, release, and you can expel your bowel movement. Again, when there's a disconnect between the brain and the bowel, you can have these accidents where the message is not getting to the rectum soon enough, or it's not giving you enough time to get to the bathroom. Next slide. So there are several different types of bladder control problems, and it is really important to sort of figure out which problem that you have, because there can be different therapies offered for these different reasons. So we're going to talk about stress incontinence, urinary retention, and overactive bladder. Next slide. So for my ladies out there who especially have had children, doesn't matter if you've had C-sections or vaginal birth, but we often talk about sort of leakage when things like we're laughing, when we're coughing, when we're sneezing. So these are really common things that can happen because of the pelvic floor muscles become a little bit weakened after you've had children. So oftentimes, your gynecologist or your urologist will recommend doing exercises to strengthen those muscles. And oftentimes they can offer you medications to treat this as well. Unfortunately, the little leakage that you can get with stress incontinence isn't necessarily treatable by the advanced treatments I'm going to talk about in a little bit. But this is a common type of incontinence that we do see. Next slide. So urinary retention is when you don't have the ability to tell if your bladder's full and to urinate. So often we see this a lot in males, but females can get this as well, where they're going to the bathroom and only a little is coming out, or they're actually having to use a catheter to, urinate. So often we see this in patients who are diabetic. They sort of get this neurogenic bladder where they're unable to tell their bladder is full, so they don't go. Also, we can see urinary retention in men who have problems with their prostate when it's too enlarged. So the advanced therapy that I talk about can be helpful in this situation. So the most common incontinence or urinary leakage that we do see is called overactive bladder. An overactive bladder is separated into sort of two different categories. You have the urge incontinence, where you go before you actually get to the bathroom. And then you have the urinary frequency type, and that's where you're going so many times a day. So if you're going 8 or more times a day, you're constantly going to the bathroom and you have that uncontrollable urge to go. And it just feels like your bladder is never empty. So this is one of the most common treatments that I help with in patients who have urinary leakage. Next slide. So fecal incontinence is also known as stool leakage or seepage. And it's basically, you don't have the ability to hold your bowels. Like you're squeezing that rectum tight, but you just don't have the ability to keep your stool inside your rectum. And either some will come out or a little will come out. It can be formed stool or it can be liquid stool. You can have the feeling that you have to go, but you can't hold it. Or you can even go a little bit and have no idea that something's come out, and you only realize it because you can smell something, or you feel that you've stained like your pants. So next slide. Now we're going to talk about treating incontinence and sort of the different modalities that we have out there to treat. So I'm big on lifestyle changes. I definitely like to try oral medications, but I think it's really important that everyone be aware that beyond lifestyle, diet, and medications, there are advanced therapies that are incredibly helpful. So lifestyle changes that can work, for some of your issues. So if you have urinary leakage, then you really have to look at what are you drinking. So certain things that are going to sort of make you go to the bathroom more are anything that has caffeine in it. So I often talk to my patients, how many cups of coffee are you having? How much soda are you drinking it? When are you drinking it? So I normally, guide to my patients, like no more than 2 caffeinated drinks a day. Otherwise, try to do decaf, which does have a little bit of caffeine in it, but it's not a full caffeinated drink. If you're urinating several times at night, so we talk about when's the last time that you drink something before you go to sleep. And basically, I cut my patients off at 6 o'clock. If you're going to go to sleep at 9 or 10, don't drink anything after 6. If you need like a sip of water because your mouth is a little bit dry, something like that is okay. But beyond that, I say take that water away from your bedside table. We also talk about medications. So if you're taking water pills like Lasix or hydrochlorothiazide, this can also increase the amount that you urinate. So timing these appropriately. So trying not to take them at night so you're waking up so many times. Maybe if you have to do something during the day, try taking the medication in the afternoon. But sort of figuring out the timing is going to be really helpful. So that's on sort of the urinary end. If you're having stool leakage, the first thing that I highly recommend is fiber. Adding fiber in your diet can bulk up your stool so they're a little bit like thicker, a little bit more solid, so there's a less chance of it seepage happening. So diet plays a really important role. Now, one of the simple things that can be fixed as you get older is if you have problems with milk or dairy, cheese, yogurt. As you get older, sometimes people develop lactose intolerance. And with lactose intolerance, it can completely cause diarrhea. And as a result of the diarrhea, sometimes you can lose control. So often I'll ask my patients to go on a dairy-free diet for about 2 weeks to see if that has an impact on their leakage. And then again, other things that can be done to ensure things are healthy is to make sure you've had your colonoscopy, because we always want to make sure that your colon is healthy and there's nothing else that could be going on that could be causing your symptoms. It is Colon Cancer Awareness Month. I'm going to throw that plug in there, March. So if you haven't already, get your colonoscopy done if you're due. Colonoscopy saves lives, and if colon cancer is found, it's treatable and it's beatable. So sort of back to this issue, medications that we try for stool leakage are simple things that are over the counter, like Imodium or Pepto-Bismol. Those are things that we can try to see if it's going to have an impact on your symptoms. Medications for your bladder, there's several of them out there. You might have heard of them. There's Vesicare, oxybutynin, there's Myrbetriq. There's a slew of them. These medications can be helpful. And before we try any sort of advanced therapy, we always want to make sure some medications are tried for at least 4 to 6 weeks. The unfortunate part about these medications is a lot of them do cause some unfavorable side effects like dry mouth, blurry vision, constipation, hypertension. So one of the things that I see when patients come to see me is they've tried 1 or 2 different types of medications, and just because of side effects, they haven't been able to really continue with them. And, as the slide said, 72% of patients stop taking medications within 6 months, either because of the side effects or if they just don't work that well as much as they would like. Next slide. So in sort of talking about, medications not working and dissatisfaction in current treatments, it sometimes does take several steps and several medications to ensure that we've tried all the therapies available. But what we've noticed is, patients who have urinary leakage or even stool leakage, they don't come back and see the doctor to talk about it like 60% of the time. 80% of the time, they don't come back after their second appointment, and 90% don't come back after their third. So it's unfortunate because we have these therapies out there, and, I like to talk about them right in the beginning to say, hey, we have this great therapy. You might not be ready for it yet, but let's start here with diet changes. Next step is going to be, let's start medications. And if that doesn't work, hey, this is going to be another option. So really following up with your doctor or your urologist to explore all the options that are out there, because something should be there that's going to be able to help you and your symptoms. So as we talk about, medical therapy, dietary changes, if they don't work, then there are different options available for you. It's pretty easy when you have stool leakage. There aren't many options aside from your colonoscopy, making sure everything looks okay, trying medications like Imodium or Pepto-Bismol, and trying fiber therapy. If those things don't work, we can absolutely talk about advanced therapy. With bladder control issues, you're lucky because there are several options actually out there for treatment aside from medications. I'm not a urologist. I do work closely with several of them. So in terms of coming up the best treatment plan for you, these options should be offered. And, I'll sort of go through them just a little bit. So next slide. So, you not only can Botox the face, but you can Botox your bladder. So this is a treatment that can be offered for patients where Botox is injected to different areas of the bladder muscle. Its efficacy, unfortunately, is that of oral medications, and it is something that you may have to do several times. Side effects of this could be urinary retention, but studies have shown that after patients get their first treatment, they don't necessarily want to come back for more, but it is an option that is not so invasive. Next slide. So this is interesting. This is percutaneous tibial neuromodulation. Again, I don't know a significant amount of this, but it's basically a treatment for treating urgency, frequency, and urinary incontinence. And it's where you stimulate the tibial nerve from the area of your foot to see if you can normalize the bladder's natural reflexes. Next slide. And so this is a therapy that I offer my patients when they have failed diet or medical therapy, and it's called sacral neuromodulation. And basically what it is it's a stimulator that stimulates the nerve that controls both the rectum and the bladder. And it gently causes this stimulation to somehow recreate that connection between the brain and the bladder and the rectum. What's wonderful about this system, and it's why I usually recommend patients to really keep an open mind, is I don't do anything permanent. I offer a test to first see, is this a therapy that's really going to help you? And I think, with Medtronic, this is something that, is wonderful. It's kind of like a try it before you buy it. There's no harm and there's no downfall in testing this out to see if it works. It's kind of like taking a medication to see if it's going to help you. The trial is done in my office where I place temporary wires, not in your back, not in your spine, but just above your buttocks. These wires are taped down so you don't see anything. No one's going to know that you have this test trial happening. And basically, you're going to wear these wires for about 7 days and keep a diary of what your symptoms are like. And at the end of the trial, it's a matter of saying, yes, I think this helped, or no, it didn't. Next slide. And so hundreds of thousands of people over the US have tried this therapy. It's a simple therapy in the beginning when we try things out. If it works for you and you want a permanent placement, it's a very simple procedure. If you can go back one slide. If you can look at the picture where the guy has the 2 stimulators in your hand, this is the size of the stimulator. So it's kind of almost the size of like a large silver dollar, or like a flash drive. And if this works for you, this gets inserted underneath your buttocks muscle. You don't feel it. No one's going to be able to see it. It's very small. This does not interfere with any kind of MRIs or getting surgery or going through, an X-ray machine at airport. You're not going to make things go beeping like crazy. So go next slide. Look at the next slide. So as I mentioned, some people, can have back issues or have other neurologic issues where they have to get MRIs. This is MRI compatible. So this shouldn't prohibit you from ever getting an MRI. Next slide. So is this a right therapy for you? What I say is keep an open mind. Try out, medical therapy, dietary changes, but keep this as an open mind if those therapies don't work for you. Now, a little bit about Medtronic. This therapy has been around for 25 plus years. It started with urinary issues and then made its way over to bowel issues. When I finished my training, which was over 10 years ago, I had no idea about this therapy. So if your primary care doctor doesn't know, that's okay, because that's a common thing that we hear, that they just don't know about this therapy. I learned about this therapy when I was in my second job. Someone from the company said, hey, we have this treatment for patients who have bowel leakage. Would you be interested in learning? And so he talked a little bit about it. And when he initially told me what I would be doing, I'm just like, I'm a gastroenterologist. I put cameras in patients' rectums and through their mouths. I don't know anything about, putting wires, above the buttocks. It was totally foreign to me. And he just told me, he's like, just keep an open mind. And so I went to then go train with a gastroenterologist in Colorado who was doing these regularly. And she told me that the most satisfying part of her career was helping her patients who have urinary and bowel leakage. That, finding a cancer was great, saving someone that way, they were really appreciative. But when she helped a patient with their urinary or bowel issues, she said that was the most satisfying part of her career. And it was sort of after that meeting that I had with her, I was just like, you know what, I'm going to try this. And I can say for myself, my favorite part of, being a gastroenterologist is really helping people with these issues. Next slide. So I'm sure you guys have a lot of questions that I think we will be taking today. I see patients throughout the triad, in High Point and in Greensboro. I also see patients on weekends. So I'm actually working this weekend at our Battleground location in Greensboro, and I have several openings. So if you want to be seen on Saturday or after that, please take down our contact person's name, Wendy Brown. You can call her, email her, and she'll be completely happy to set you up with an appointment.
Perfect. So yes, I just want to remind people that we have that Q&A function at the bottom. So please submit your questions there. We do have one. It says, so what do we do about the leakage of poop?
So the first thing that I usually recommend to my patients is, have you had your colonoscopy? That's always the first step to make sure that everything looks normal within the colon. If the colonoscopy is normal, there's no evidence of any kind of colitis or like inflammation, the next step would be to really try medications and fiber. So I recommend something like Metamucil once a day or Benefiber once a day. And then I would recommend medical treatment, which is anything like Imodium or Pepto-Bismol, and do a trial of those medications, one of them for at least 4 to 6 weeks. If that doesn't work and you're still experiencing issues, InterStim sacral neuromodulation would really be the next step.
Perfect. Someone's asking about the approximate cost.
The what?
The cost of the device.
So this is very well covered by insurance, definitely with Medicare and with other insurances as well. If you are a candidate for the procedure, then our office calls your insurance to verify benefits. But from my patients' experiences in the past from all different insurances, it is very well covered.
Does this conflict with cardiac pacemakers or diabetic monitors?
No, there's no interference with, pacemakers, ICDs, pain stimulators. So I have some patients who have a pain stimulator on one side of their butt, and then they have the sacral neuromodulator on the other side of the butt. So it will not interfere with other devices that you might have.
Someone mentioned when they go to the restroom, they always have diarrhea. They're not sure if this could help. Any thoughts on that?
So definitely I've noticed that patients who have diarrhea also have some amount of leakage. Or if you have a diarrhea with a lot of urgency, like if you didn't make it to the bathroom now, you would have an accident. This would be something that would be helpful for those patients.
If someone's a caregiver for their husband, would it be easy for them to work? The programmer, I'm assuming.
Absolutely. Yeah, absolutely. This is a very user-friendly device that as a caregiver, if you were helping someone who are having these issues, it would make the patient's life a lot easier and the caregiver's life a lot easier. So it can definitely be helpful for both.
Someone mentioned, can you prescribe pelvic floor physical therapy to see if that helps first?
Yes. So I do often have my patients, if they really don't want to do medication, see pelvic floor therapy to see if there's something that they can do to strengthen those muscles.
There's someone who's mentioned that. Oh,
I wanted to say the pelvic floor therapy can help much more in sort of the urinary world, not so much when there's bowel leakage.
Got it. So there's someone on here that says they've tried everything and they're on fluid pills and they're tired of wearing diapers when they go on a long trip. So that sounds like someone who should make an appointment with you to discuss next steps.
Yeah, I think, if you're having these issues and you're frustrated and, you're not getting answers, then yeah, definitely come see me.
There's another one who's asking, will the device slow down the urgency of having to run to the bathroom?
Yes, so that's one of the goals of sacral neuromodulation, is to really stimulate things. And what patients have said is they get the urge earlier. So there's no like urgency that, oh my God, I have to get to the bathroom and I have to get there now. So you kind of get that feeling, okay, I think I got to go. And it gives them enough time to be able to get to the bathroom.
We have an attendee who has been recommended pelvic floor therapy and massages. Do you have any thoughts on that?
Is it for urinary issues?
They didn't mention.
Okay. So like I said, I think the pelvic floor therapy can help much more if there's a urinary issue. And so I would say definitely try it, and give it a good try. So you want to give several sessions, several weeks of therapy, before thinking if it's helpful or not.
Do you perform colonoscopy tests in your facility? That's a question.
We do. So we do colonoscopies, our outpatient endoscopy center in High Point. It's near the Palladium. So it's easy access from High Point, Greensboro, and even areas like Winston and Kernersville.
I think there's some confusion. Someone's asking, so it doesn't go under the skin, it stays outside. So maybe just
Yeah, so
finding
the
the difference.
testing, sure. So the testing that we do initially, the testing that I do, everything is external. I don't do any cutting. I put wires that get connected to the nerves that control your bladder and your rectum. And those wires will get sort of taped down, and you'll have a monitor that can control the settings. So that part, when you do the testing, is external. Permanent placement, everything is internalized. So kind of like a pacemaker, where you don't see the wires, you don't see the pacers, everything is going to be underneath the skin and the tissue.
Can you discuss what recovery is like?
So recovery after testing, there really is no recovery. You're back to normal right after we put the wires in. And you're supposed to go about your normal activities over the next 5 to 7 days. And then when you need to come back to get the wires removed, it's simply a 2-minute office visit where we remove the wires. Permanent placement is, a really simple outpatient procedure. I don't even like to call it surgery. It's a procedure. You go in, you get the permanent placement, and then you are out the door the same day.
Then we have a question regarding constipation, if the InterStim can help with that.
So InterStim currently is not approved for constipation. They are doing studies in different areas of the world trying to see if it's going to be effective treatment, but currently it's not approved for this indication.
Someone's asking about the trial, and then how does that work for taking a shower?
So yeah, that's probably the worst part. I'll be honest about the testing, is you can't really take a shower, but you can kind of take like a little bird bath and, just sponge yourself, get someone to wash your hair for you, but you can't fully get immersed in water. You do want to keep the wires clean. So if you're planning like a vacation to the beach, it wouldn't be the best time to do a trial.
How long does the procedure take if they want to get the implant?
So the temporary wires, the testing that I do, that usually takes about 15 to 20 minutes. It's done in the office. I can give you a little something to make you relaxed, or you can not have anything and drive yourself there and back. The permanent placement, it usually takes maybe about an hour to implant at an outpatient facility.
Great. I don't think we have any other questions at this time. So people are just asking, how do they sign up? And I think the best thing is really setting that appointment, contacting Wendy Brown with that information here on the screen. But Stephanie, I'll hand it over to you.
Yes, thanks everyone for being here. And thank you, Dr. Shahid, for your time and your presentation and all that great knowledge. And remember, if you want to call and sign up for an appointment, that information is on the screen so that you can schedule an appointment. And there's actually some availability this Saturday. But everyone have a great night and thanks for joining us.
Thank you, guys.